The most surprising finding for me with this work is that whilst men's health has improved a lot over the last 20 years, most of that improvement has come for men over the age of 60, and half of that improvement has been related to improvements in cardiovascular disease. The main health challenges that face men today, I think, relate primarily to mental health concerns. Over the last 20 years, one of the things that's become apparent in doing these three papers is that suicide rates for men have barely changed over the last 20 years. And the latest statistics show that 78% of all suicides in the UK are male suicides. Although we've had the improvements in cardiac disease that I've pointed out, and we've had good improvements as well in cancer outcomes for men, those still remain the main causes of mortality. When I first did this work 20 years ago, there was only a handful really of community-based projects looking at promoting health for men. Now, this time when I was trying to put the paper together, there was far more than I could possibly mention within one paper, and we had to just pick some examples of the most interesting and dynamic projects. So that's been a huge change. We still have not made a lot of progress in relation to improving life expectancy for particular groups of men, especially men from areas of socio-economic deprivation, but also other groups of men, like a lot of men from black and minority ethnic communities. We are stuck currently with a lot of health promotion approaches that work only at the level of the individual. And I think these models of individual behaviour change are never going to overcome these issues that we need to address. So we need to look more at how policy, particularly housing policy, employment policy, and other policies that promote social justice, can be implemented, because that would be a far more effective way of improving men's health into the future. In terms of what's next and where this work might take us, clearly I've already said that there's a strong emphasis on mental health. We've done a lot around mental health in the centre over the last 5 years, but there's an awful lot more still to be done. I think the other area that we've been doing work in and want to continue to develop is looking at what makes for successful interventions for fathers in community settings. This is a group that I haven't really mentioned in the current paper, but nonetheless it's an important group to think about in terms of the fact that fatherhood does provide a lever to engage in health promotion work with men. So these are two areas that the centre are definitely going to be focusing on in the coming years. And in relation to the 2025 paper, for me personally, I'm going to tie that in with retirement.